After a long journey, they got their bravery back. The agony stored inside their heart seemed as a never-ending path of pain that has been wiped down, and the inner roar got diffused. Finally, they won against acid violence. Acid violence is a vicious and damaging form of violence. Acid is mostly thrown on the face to destroy the life of a person. It has catastrophic effect on human body. When acid attacks eyes, it damages them permanently. It causes skin tissue to melt, often exposing bones and sometimes even dissolving bones. No one can ever get back the former look. The Acid Survivors Foundation ASF was formed in Bangladesh on 12 May 1999. ASF's mission is to stop acid and other form of burn violence and to help burn survivors rebuild their lives. Since its inception in 1999, ASF identified nearly 3,000 people attacked with acid. Overwhelming majority of them are women and children. Reasons of acid attacks are many: rejection of marriage proposal or sexual advances, dowry-related disputes, family and marital disputes, and land-related disputes. Though women and children are not the land owners, but often they are the victims of acid attack for land disputes. Injury caused by acid burns need long-term treatment in specialized hospital. Burn treatment facility in Bangladesh is limited. ASF runs a 20-bed hospital where victim of acid and other burn violence receives comprehensive medical treatment completely free. This hospital provides homely and secured environment for burn victims. Many survivors are working here as caregiver. Patients also receive free physiotherapy from specialized burn experts. Without voluntary support from expert plastic surgeons from home and abroad, it would not have been possible for ASF to aid the recovery of acid survivors as near as possible to that of their pre-attack situation. ASF could provide prompt treatment to Neela within 48 hours of her attack, and the result was tremendous. ASF could save her vision, and she returned to her educational institution after 3 months of her first phase treatment. Durjoy was fed acid when he was only 1 month old. Acid damaged his internal mouth severely. Though ASF could provide best available medical treatment to thousands of acid burns in the country, but Durjoy is one of the few cases who need treatment abroad. To decentralize burn treatment facility around the country, ASF, in partnership with Ministry of Health, implements essential burn care course for doctors and nurses at local level. Acid attack not only affects physically but severely damages their psychological well-being. ASF provides basic counseling and psychotherapy to the survivors to help them to cope with their changed situation. For creative and emotional development, art therapy sessions are effective, especially for child victims and for children whose parents are acid survivors. ASF also arranges music therapy. It helps them to regain their confidence and even perform in public. Economic independence is vitally important to enable survivors to confidently manage their lives and gain respect from their family, their peers, and community. ASF arranges skill development training and finds suitable employment for them. A group of survivors have been trained by international occupational therapists to produce fresher garment in Bangladesh. ASF also works with communities to develop psychosocial capacity to enhance survivors' better acceptance in family and community. Integrated approach helps the survivors to rebuild their lives and to live a life with respect and dignity. Acid violence is a criminal act. Survivors often complain about difficulties in attaining legal recourses. As a result of ASF's advocacy, Government of Bangladesh passed 2 laws and established National Acid Control Council and District Acid Control Committees. Government also established a central monitoring cell to monitor effective implementation of acid laws. ASF also conducts dialogues with the local acid sellers associations to reduce illegal use of acid. From 1999 to 2002, every year, ASF observed sharp increase in acid attack. In the year 2002, on International Women's Day, for the first time in Bangladesh, ASF mobilized thousands of men marching on the street to stop violence against women. Acid survivors are also actively engaged in raising social awareness, sensitizing professionals, making government and civil society responsive to combat acid violence.
গতকাল মধ্যরাতে তাদের ছোট বউ আমাদের কুসুম অ্যাসিড দগ্ধ হয়েছে। হে দৃশ্যে অবাক হয়ে বনের কোকিলার অরণ্যের বাঘ আমাকে বিদ্রূপ করে কুশল শুধায়, মানুষ তুমি কেমন আছো? আর কোন মুখ যেন ঝলসে না যায়, বন্ধ হোক অ্যাসিড সন্ধ্যা সবাই চায়।
With successful prevention campaign, the actual number of acid violence is much less than what it could have been without any intervention.
To fight this hideous crime and difficult. So congratulations.
ASF has gained reputation in country and abroad. Seeing the success of ASF in Bangladesh, many other countries like Pakistan, Cambodia and Uganda has initiated similar organization. However, still in Bangladesh, there is one attack every 2 days. Acid attack has reduced but not stopped. Together, we can stop acid violence. Together, we can help acid survivors to live a life with dignity.